Well, it's 10:05, so we'll continue this symposium, the latest session, which will be chaired by Justin Ward and is on the topic of understanding and using the targets and data. Introducing Justin Ward, he is Head of Policy and Technical Practice at the Chartered Institution of Highways and Transportation, which is a charity and a learned society for highways and transport professionals in the UK and internationally. Justin leads CIHT's policy and technical work to improve how transport infrastructure is planned, funded, designed, built, managed, and operated to meet societal needs, environmental imperatives, and economic goals. Justin also works on international knowledge exchange around roads and road transport policy within an integrated, sustainable transport context. So over to you, Justin. We'll look forward to this session. Thank you.
Thank you so much. I'd ask the fellow panel members to turn on their cameras, if that's okay, just to join. So we're joined by Richard Owen today from Agilysis, Susie Sharman from the Road Safety Foundation, Ivo Wengraf from the RAC Foundation, and Ross Morlock from Brake. So if they could turn on the cameras and mics, that'd be great, and then we can get underway. So I think we've heard a number of elements this morning which are really interesting in terms of the ambition. I think is widely welcomed about the target that has been set. But what I want to do is kind of go into some of the detail today with the panel around how we understand how achievable that is in terms of both the kind of level of ambition, what needs to happen, but also do we understand enough about how we will get there and kind of what data we might require to get there as well, which I think is critical. And in sort of thinking about this, it kind of came back that sort of Rumsfeld phrase of what we know, what we don't know, and what we don't know, we don't know. So these elements to the equation of the unknown knowns and so on. So I'd like to start off, before we do that, for asking the panel to introduce themselves and then explain in the context of sort of the analogy I thought was around the pathway to net zero that the CCC set, and looking at all the range of measures from their view, what they think will be some of the critical measures. I think, Susie, if I start with you, because you'd already indicated a little bit in that space, but introducing yourself, and then also about what actually needs to happen to get to that net zero or that kind of 65% reduction that's in the strategy.
Hi there. Susie Charman again, from the Road Safety Foundation. We're a small charity working primarily in the sort of roads and speed space. My history is that I've been working in safe system delivery for 15 to 20 years, first of all internationally, and writing national road safety strategies and action plans in different countries. So that's where I'm coming from. Did you want me to comment on anything to do with the targets yet, or were you going to introduce Rob?
Well, I think, yeah, if you don't mind saying a little bit about that, about where you would see the kind of, there's a lot in the strategy and what elements need to happen in your view to achieve that 10% year-on-year reduction. It's pretty significant. And I think in the past, those kind of reductions have been things like equivalent to the introduction of seatbelt use, mandating that, or things like the change in Wales. But I don't know just a few measures that you think would be important, and then we'll go to Richard Owen next.
So just putting the ambition of 65% into real context here. If you look back over recent times, we've seen average annual reductions in death and serious injury of about, just over 1% each year. So we're talking about a really transformative change here, a real step change that's needed to reach this incredibly strong level of ambition. I just want to reflect on that level of ambition being a good thing. I'm not saying that it's a bad thing by any stretch, because it demonstrates that road safety is a national priority ultimately, and that will help to galvanise action, and it really does demonstrate leadership. But these are really ambitious, and we have had a massive history in the UK of introducing very, very strong evidence-led road safety interventions, and they've together produced relatively modest gradual reductions in KSI. So, the question here is what's in the strategy at the moment? Are they things that are going to continue those very important but modest gradual reductions, or are they going to be things that create the step change that get us to a 10% reduction every year until 2035? And I suppose the thing that we're unsure of is whether there's been any analysis on those measures so far and what they're collectively likely to deliver. I'm not aware of that work, though I'm sure some very deep thinking has gone into the strategy. But as Kathy alluded in her presentation earlier and her comments earlier, these are the measures that DFT can bring forward. These are not all of the measures, and there will be more. And I suppose my reflection from having written national road safety strategies is that we always also used to develop a very, very detailed action plan, which had really clear allocation of responsibilities, strong accountability mechanisms, sustained funding that matches that scale of ambition, and also that sort of ability to continually monitor and track. So I suppose I don't know if that really answers your question, Justin, but that's where I've got to is it enough? Well, I think even there's recognition that it's a starting point. The things that DFT are able to deliver, actually, there's more to be done by all of us collectively. And what are those things? And let's start to develop that national action plan alongside the strategy to flesh that out and move us forward. Oh, you're on mute.
On mute. No, thanks very much. That's great. So turn to Richard Owen next from Agilysis. Just a brief introduction, and then what you think are the key measures, briefly, in kind of being able to get to that target.
Thanks, Justin. Yes, Richard Owen, CEO of Agilysis. I think I'd just like to show some numbers here, just to clarify exactly what this level of ambition is, and just confirm exactly what Susie has been saying already. I'm just going to show a piece of analysis that we did, and I know this is something that other people have been doing as well. So there's that historical trend. We did some analysis of this within the team, and you can see that we had some great reductions in the early part of this millennium, and then we had that leveling off. Stagnation is a word that a lot of people have used, and I think everybody would agree on that one. But there was some reduction. Obviously, we've got the COVID blip in there. If we're now looking at what it is that we need to do, the numbers are really huge, but the opportunity is really huge. 100,000 cumulative killed or seriously injured casualties saved over that period. It's easy just to look at the one individual year and see if we get to 2035 we've saved this, but look at that shaded green area. That is the opportunity that we have. That's the number of people and loved ones that we can spare from death and trauma and indeed misery. But in order to get there, we probably need to reflect on where we have been in the past. So what we also did is we had a look at what performance has looked like previously. So we looked at where we're going. So that's the performance trend. That's the top line. That's where we're going to get to if we just carry on doing what we've done over the last 20 or so years, which actually we did some really, really great work within there. But if we push it further and we achieve the kind of casualty reduction that we had in the earlier part of the century, then we could save an extra 38,000 on top. But we've still got that big gap. Even if we projected the best period of casualty reduction that we've seen in recent history, we're still going to be missing out on that target by 62,000 cumulative over that period. So I think, that information, I think, really puts it sharply into focus. In terms of what we could do, well, I'm going to pick on one that is related to speed and speed limits. If you look at what happened in Wales, which was an undeniable success in terms of speed reduction and casualty reduction, yes, there may have been political casualties. Yes, there may have been some very vocal people online, a small number of people online complaining about the changes. If we just flicked that switch, we could get over 1,500 casualties overnight in England and Scotland. Obviously, they've had the casualty reduction in Wales. You can't reapply that. But if we switched 90% of our urban roads to 20 miles per hour, it's a default. It's not a blanket. There are some roads that we can operate at those higher speeds. Then that would give us, as I said, 1,648, I think was the calculation that we did on it. So there are policy measures that we know will work. We can work out what those casualty reductions would be, but we need the decision. I do not expect government to suddenly turn around and say that we are going to have a default 20 miles per hour. But what we do need is really, really strong guidelines within that, setting local speed limits for local authorities. It says that 20 is the default, but critically think about what roads don't need to be 20 as well. That was one of the key lessons from Wales, is actually putting in place clear guidelines on what urban roads don't need to be 20.
Thanks. And I think that the 20 is the sort of default expectation. Did come out in 2020 in Sweden, and the UK, I think, played a role in drafting that was it the UN Declaration on Road Safety? So I think there are sort of references back to that, but I think the political wording is probably quite important to land at, and how that makes that work at a local level. But no, thanks so much for showing that pathway, because I was the sort of the detail behind that is, I think, really important, how we actually modeled getting to that 35 and what interventions need to happen. Now I've got all the speakers in front of me. It's easier to see that you're all here and got your cameras on. So apologies first. I sort of scrolled through to see you were there. But can I turn to Ivo now from the REC Foundation, just to introduce yourself and some thoughts on the measures, and then we'll turn to Ross, and then we'll go into some of the data. I think what we know and what we don't know, and then maybe what's emerging. I think we'll get into that after.
My name's Ivo Wengraf. I'm Research and Data Manager at the REC Foundation. And my main interest is in the linking of various types of government and commercial data sets for sort of policy intervention. And I think it's been touched on already, but one of the bits of this that concerns me is that a lot of the data-focused or technologically focused interventions have a sort of silent time lag that we're not necessarily considering. So new vehicle technology will be reliant on the vibrancy of the new car market and the extent to which old cars leave the park, and that will take years and years to have any meaningful effect, and that's just part of the nature of the churn in the vehicle park. The investigation branch, from what I understand, I hope I'm wrong here, from what I understand, they don't have the same statutory legal powers for data access that the other investigation branches have, which means I'm very confident that there will be years wasted in tedious meetings about data sharing agreements. And even at that point, there will then need to be a long time to do investigation. And then after that point, you have to hope that you get conclusions, those conclusions create interventions, and those interventions then bite. So I think there's the element of, we reinforce this, to hit these targets, we so desperately need to crack on that it doesn't bear thinking about. And some of these big hitter policies have an inbuilt time lag that I don't think we're necessarily thinking about, that they must work so much quicker. Similarly, the history of use of administrative data and data linkage in government is, I'll be honest, pretty poor. And there's definitely scope for some of these these things to grind to a halt. There's a long history of that. And we haven't really got the time for any of these sort of big data-focused interventions to not work immediately. And I think that's the sort of the hidden element here of how quickly will these things kick in.
Okay, thanks. That was excellent, Ivo. You gave a link to data access. So I will, just to plant the kind of thoughts in your minds about Stats 19 and data access, I will want to explore that a little bit. And apologies, just to be clear to the great audience here, we have not pre-prepped this. So the panelists are very much thinking on their feet with this one. So hopefully that won't be too drastic for them in doing so. But I think we've got a suitable expertise to be able to go into that area of unexplored terrain. Ross, do you want to introduce yourself next, and some thoughts around the interventions? It's just kind of useful to get views from the sector on that, and then we'll dive into data a bit more.
Yes, good morning, everybody. I'm Ross Morlock, Chief Executive at Break, the road safety charity. At Break, we work every day at kind of both ends of the system, really, driving prevention to stop crashes from happening and reducing harm when they do, and also standing alongside the families whose lives have already been torn apart by road crashes. At the moment, our National Road Victim Service is supporting over 1,000 people who have been bereaved or seriously injured on our roads. So, I think that acts as an important reminder that these targets and data sets that we're discussing today represent real people, real trauma, and real loss. At Break, we really endorse the ambition of the 65% reduction in care size, and the even more ambitious 70% reduction for children. I think there's consensus across everything we've heard already today, and lots over the last few weeks and months, that they are ambitious, they are bold, perhaps bolder and more ambitious than many of us might have been expecting. As well as Ruth alluded to in the first session, I think the KPI for children, young people, is particularly important to see. I'm really pleased that is specifically included within there. I think we're all in agreement as well, by the sounds of it, that we've got to be honest. Ambition alone is not going to get us there, as Ivo's kind of alluded to in his introduction a moment ago. We're going to need alignment and quick and fast alignment across a number of different kind of group stakeholders, government departments, integration with police performance frameworks, recognition that road safety is central to safer communities and not an optional extra. And, we've touched upon already in some discussions this morning around the importance of these national targets coming down into kind of regions, local authorities as well, and having clear accountability regionally and locally. I think from my perspective, one thing that, certainly I've not seen, and again, based on what we've heard already this morning, I don't think others necessarily have either, is kind of understanding what's led to these these targets, these national targets that have been set, the data behind those. Already other panel members have talked around some of those interventions. What are we expecting? What are we forecasting? That those interventions are actually likely to deliver, and over what period? And then what are the gaps? Because as we've said already, I think it feels like we are going to need to go further than the measures that are currently specifically referenced within the strategy. Speed is a fairly obvious one to focus on in that regard. But it's really important that we almost kind of mark the homework up to this point to understand actually, well, where are we thinking those interventions are going to get us? What are the gaps? Where else are we going to need to focus? And just finally, to Ivo's point as well, the importance of getting going with this. Susie and others have talked already about that gap, and that actually we might not see reductions in the first couple of years, or serious reductions towards these targets in the first couple of years. We need to get going with this quickly. We need bold, decisive leadership. We need to get all the infrastructure in place as quickly as possible. Otherwise, these bold and ambitious targets are going to turn into something that might start to be quite unachievable if we're not careful. We need to get going with them.
Okay, thanks very much, Ross. I think that's an excellent summary. I think that pace that's required. And Susie, you'd alluded to that earlier, 10% first year. We need to keep that pace each year, maybe even more so. But the scale of it's a bit like this, the pathways to decarbonisation, the uptake in EVs, uncertainty around that, the sort of uptake in new vehicles is also kind of quite important for that in terms of the kind of pace of change that's needed. But we're not sure that actually we'll be able to see that with other policy interventions coming in. But CIHT did highlight there would be benefit in modelling data to illustrate what scale of interventions will be required to meet the target. And I think, Richard, you'd covered that. But I did want to turn back to that Rumsfeld quote about what we know and what we know we don't know. So what kind of questions do we need to answer in terms of data that we don't currently do, but we know it would be possible to do? Because there's certainly a recognition, I think, in terms of serious injuries that that data could be stronger, and what we need to know about how to get to that point in terms of improving data understanding. So what do you think needs to happen in terms of the data that we have to improve a understanding of how to achieve that target? We'll maybe start with Richard on that one, perhaps. Is that okay to put you on the spot?
Yeah, that's fine. There's a lot of things we know, but a lot of it is hidden away in different silos. One of the things we talked about at the recent Joining the Dots conference was linking data sets to get a greater understanding of what's going on. And I think that's one of the frustrations. We're working on a project at the moment for the Road Safety Trust that's having to buy commercial data that might be accessible from other sources held in deep, dark recesses of various government databases. I think it's understanding the benefit of linking this. And look, this is mentioned in the strategy. The ambition is absolutely clear there. So that will definitely help us if we can link the data that we already have and we're already paying for, making sure that, data is open as much as possible. There are some things that we don't know as well. The things that we do know that we don't know, or we don't know that we don't know. I'm not quite sure. In terms of, the casualty reduction that we had in the past, we've got a really clear idea of what some of the things that may have happened that achieve that. Improved vehicle design is definitely one of those. Improved speed enforcement definitely had an impact through other studies. So yeah, there are things that we know do work, but there are some things that we're a little bit less certain on. We did some modelling of the potential impact of reducing the national speed limit down to 50 miles per hour. Actually, that showed that it wouldn't make too much of a difference, because, hey, guess what? Most people are already driving around 50 miles per hour on our rural road networks, or even lower. So we know that introducing a 50 miles per hour limit probably wouldn't do that much. Hey, look, it would be a great start. I read an interesting article on the Daily Express this morning that said that because of the Gulf War crisis, we may have a fuel rationing and a reduced national speed limit. That may actually have an impact. Reducing the speeds that we travel at and the amount of journeys that we take would have a really big impact, even though that might not be very popular.
You didn't strike me as a Daily Express reader, Richard. So this is a bit of a surprise for. No, well, kind of understanding and linking the data to the outcomes is really important. So, any other views on that in terms of, obviously, the strategy does allude to linking data sets better, but what would sort of other panel members see as a benefit from improving data in terms of the understanding of road safety interventions? Susie, do you want to go? Yeah, I was gonna. Yeah, essentially.
Just some observations, really, that look, there are some things that we are absolutely certain of already, and their impact. And I'm going to put my neck on the line, and others will have other things that are within their domains that we know very, very certainly about. We know the relationship between speed and KSI. We know that. We don't have to wait to have better data on that. We still like to, get some really detailed data on exactly where each kind of speed reduction can be achieved through what kind of measure, and really fine tune that understanding. But we know, broadly speaking, you lower speeds just even a little bit and you have a really big impact. So that's something we know. We know about the impact of various road infrastructure measures. So we know, what happens if you clear or protect road sites? What happens if you do put in walking and cycling facilities? We know all of that, and that's stuff that we've been delivering on through Safe Roads Fund and other bits of work with National Highways as well, to sort of create that. So we don't need much more data for that. Actually, we need to continually evaluate and model and just make sure that we're doing it right. But ultimately, we can crack on. The one thing that I'm really interested in is the linking of collision data with health data. And the reason for that is because I think we do a woefully bad job of making the investment case. Unfortunately, because death and serious injury doesn't affect everybody, people don't see the impact on them, and therefore they might care a little less than perhaps we do who are involved in this area of working, or those of us who have been touched by death or serious injury in the past. So I would like to know, how many operations are people having when they have a very serious injury? I've heard anecdotal cases of, 10, 12. What does that mean for my mum or dad who might need a knee operation or a hip operation? The unplanned trauma getting in the way of the planned kind of orthopedic surgery, for example. What hits everybody collectively? What's the impact on GP services of people having to attend lots and lots of medical appointments because they've been hurt? What's the impact on mental health services? How much loss of productivity do we really have? People having to move away from productive careers because they can no longer cope because they got PTSD or depression following a road traffic collision, which we know is something that happens. So how do we better articulate to everybody the things that are going to definitely affect them? Not just the chance that you might be one of the very, very, very unfortunate people that are going to be killed or seriously injured, which a lifetime risk is 1 in 28, by the way. So for everybody here now in Great Britain, you've got a 1 in 28 risk of being killed or seriously injured in a road traffic collision sometime in your life. But that's still odds that people seem to not really take heed of or are unaware of. So let's translate that into what's really going to impact everybody. The other thing that I wanted to mention was the work that we're doing on safe system fatal review panels. Now, this work is by no means high tech. It's by no means, data thirsty or so on. But it's something that we can do now to get a better grasp of the safe system interventions that would be effective, or to provide that evidencing of those interventions. And what happens there is that multidisciplinary panels get together. They review the details of a fatal incident. They collectively discern what things could have made a difference that could then be systemically applied across the board to prevent other similar collisions from having a fatal outcome in the future. And the outcomes from that and the recommendations from that, I hope, will find a home in the road safety investigation branch, for example. It's not high tech or whizzy and we're feeling our way through trying to establish the right sort of protocols for it and how to report it and so on, so that we make a good job of it. But ultimately, that could be something that we can get cracking on in the short term to enhance our understanding.
Okay. Thank you, Susie. Ivo, sorry, I'd seen you pick your hand up briefly, but then pop that.
Yeah, no, I do it. I have something to follow on from what Susie said, and then my own point. The first thing on the total business case, just as an example, when we were involved in the pilot project for the investigation branch, we I recognize it's trivial, but we factored in delay cost for large incidents on the strategic road network, and that is frankly a random large number generator for business case. It's absolutely transformational, and yet that originally hit buffers because at a very low level, certain people who needed to input data couldn't really see the value to them of inputting that data. And that, I think, goes to my broader point about how the data linkage has to work, that I'm not sure we're thinking through carefully enough, is that you can have very high level buy-in, and we know that Prana and linked health data has frankly the highest level buy-in that it could ever hope for. But there's also, frankly, some bloke in a room with few to no windows who knows how to write SQL queries, who also has to have buy-in, that they have to actually do work, extract stuff from databases and send it to people. And they can feel very, very distant from the policy discussion, and they can have pressure to on their own workday that really means that it's not important to them. And that's usually how data linkage projects begin to fall apart. That you have very senior people go, "This is terribly important," and very junior people go, "This is fantastically unimportant." And it's the fantastically unimportant people in this picture who actually hold the power. And without them, you're nowhere. So just worth reminding, just worth being aware of that you need buy-in from both to make that work. Other things that we don't know, and I think is worth investigating, is that the projections of new vehicle safety benefits come both from laboratory tests of vehicles, not real world safety impacts of vehicles, and also from the DFT's environmental modeling of the take-up of electric vehicles and the carbon stuff. The work that the foundation has done on the sort of carbon pathway is much less positive than the information that comes out of the DFT. The average age of vehicles is at its oldest. The average mile driven by vehicles is at its oldest. The entire tax and cost scenario of buying new vehicles is at its most problematic and challenging and difficult to negotiate for new vehicle buyer. And that bit of modeling that the department's done is pretty unexplored. And it would be worth seeing how that was actually done to understand how we might expect new vehicles to come on the road. Additionally, the gossip, I would put it no more than that, the gossip about the real world safety impact of these new vehicle technologies is that, surprise, surprise, it's less than it is in a laboratory scenario. The work that Richard and I are doing on linking vehicle characteristics data to Stats 19 hopefully would get you something closer to understanding what real world effects of those technologies are. But to go back to my original point, all of that will take years to work out, even if you were working at full pelt. The 2004 safety regulations have made older vehicles so much more robust that we're keeping vehicles on the road for longer because they're good. They're perfectly good. And we are trying to take on new vehicles at the same time as we're trying to change the entire way vehicles are powered, which is, that's two transitions at the same time. How that works is quite complicated.
Thanks. Yeah, Ross. And then I want to then afterwards we'll turn to some of the questions in the chat actually, because there have been some posted questions. So, but yeah, Ross.
Yeah, just a few quick points that certainly align with many made already. I think kind of the evidence base and that kind of existing data set the existing data that we have is a really important point here. We've mentioned a number of examples this morning of where we feel that probably the strategy could have gone further. And I do think that is really important here. Yeah, yes, there is absolutely data that is missing and further data that we need. Data accessibility is a big problem, but we've got to make sure that we're using the data and the evidence base that we do have as well to inform our decision making. Susie's spoken a bit about speed. You could apply the same to young drivers as well, where they're, yes, there are complexities with these things, but the data and the evidence base is actually very clear in these areas, and we're going, some way towards listening to the evidence, but we absolutely could go further to drive interventions that will actually, align with the whole kind of safe system framework, but also, of course, start to bring us closer towards those targets and save lives and reduce injury on our roads. I think the whole kind of linking, crashes with health data is really important. We see an awful lot of that at Brake. Obviously, we see the direct impact of road crashes on families, on loved ones, and that is still a relatively underexplored area. And it's going to be really important with this new strategy that we have that cross department working at a government level. And pleased to see with things like the Piranha project that is starting to move forward. But there's a lot more work that we need to do there to really understand the true costs when we're looking at things like employment, education, general kind of contributing to communities, to society. These are kind of all things that road crashes have a significant impact on, with individuals, with families, with households, etc. So these are really important things that we do need to understand when we're trying to build that business case for change, which is obviously such an important part of all of this. And final point I would make is just to reference, just because it is important, the prevention of future death reports, which is an opportunity and a system that exists at the moment for us to try and capture data to learn from tragedies, which is both really important to families who have gone through horrific trauma, but also it's really important from a safe system perspective to make sure that we are learning those lessons. The Road Safety Investigation Branch, I'm sure I hope certainly will help with this, but at the moment so few prevention of future death reports are actually created on a national level. And sadly, when they are created, they are often ignored because the system is not really doing what it should be doing. So from a lost data or missed data opportunity, learning from the tragedies through things like the prevention of future death reports is an area that absolutely needs to be strengthened.
Yeah, I mean, I see nods there. It's an area that we certainly could go into. I'm going to just pause though, and go to some of the questions just quickly, just because obviously there's a great opportunity to ask you some questions. Definitions, so they need to be decided ahead of the target modeling. For the DFT, a child is aged 0 to 15, but the comment is that a project that they're working on, the child RTC, their study is 0 a day before their 18th birthday. So do we need some synergy between what we are looking at? Don't know who wants to go first with that. I mean, maybe if the person's asked the question, I don't know if we can unmute them and sort of say a bit more about that. But any thoughts on that in terms of definitions? I mean, one thought I had in terms of looking at that was actually brain development, and this idea of looking at young drivers and in terms of the decision-making process and graduating driving license is the case for that in terms of neurological kind of development as well at points. So either definition of child or a bit on the kind of element of data that we understand about sort of brain development, and then also sort of how sort of road user behavior results in that. Any thoughts on that as well?
I mean, just to go back to the original question, I mean, we have to make sure that we're, comparing the same things, don't we? And looking at the same things. So from a consistency perspective, I think it's Heidi's question. We have to be clear, don't we? And set some definitions, some boundaries, a clear understanding that we're looking at the same data. And from in Heidi's example, in terms of an age, perspective, we've got to make sure that we're clear that the data that we can use can be compared consistently, used collaboratively, connected up with other data sources. So yeah, we're going to shoot ourselves in the foot pretty quickly, aren't we, if we're doing kind of important research and collecting important data, but that data actually can't stand alongside other data because certain kind of parameters and data sets are just out of kilter or out of sync with others. So it comes back to that kind of collaboration and that kind of joined up approach, doesn't this will could fall apart quite quickly if we do things in isolation and not part of a broader coordinated led approach. So yeah, I mean, I think that's really, really important.
Yeah, I'm here, Ross. Yeah, basically it was using the two definitions. Obviously, DFT do work 0 to 15. They've set an important target in the road safety strategy of a reduction in childcare size. So it seems that the very first thing we should do is get the definition right. Obviously, if we do work for 0 to 15, we do miss out on young motorcyclists and young drivers. And the study that I'm helping with at the moment, which is the Nottingham University Road Safety Trust, is able to look at a much deeper number of child deaths, because it does go from 0 to, well, it's 17. So the cutoff is the day before the 18th birthday. So it does give a much broader spectrum of road user groups, which I think is vital if we're going to look at reducing childcare size by 75%. One of the targets. So that was my reason for mentioning it. Before we start doing modelling, we need to know what is the definition of a child.
Yeah, no, well, thanks, Heidi, for adding in a bit more on that question. I think it's very good, and certainly panel members nod in agreement on that point. So just to we've got another question here. So if the person's asked it and wants to unmute and join and add any points on it, very, very happy to take that on board. But failing to look properly is one of the highest causation factors. Is there any correlation with how automation is adding to human complacency due to out of the loop performance? I don't know, Eva, do you want to say anything about that? You mentioned vehicle technology, but any links on the downsides potentially of automation? Or
to follow on from the question about definitions, I think the definition of automation is going to be one that we're going to have to begin to grapple with. And I know that there's quite an issue with trying to draw the distinctions between technology that's fitted, technology that's used, technology that's broken, technology that may or may not have been running at the time of the crash. And this is a proper minefield to try and get through. And we may simply never know on some of these questions, because it will just be impossible to determine. I think I have read some work recently that suggested that for lane change crashes in Australia, the lane assist, blind spot warning, those sorts of technologies, which I wouldn't necessarily call automation, because you run the risk of thinking it's a Waymo, but advanced driver assistance does have a benefit, but we're not. I mean, Richard and I are trying, but we're not yet at a stage in Britain where we can do that kind of work reliably. And I would say that we're not really at a stage where we're recording the data correctly across the board to do that kind of work reliably. The Stats 19 recording process isn't advanced enough to do that as well as everyone on the call here would hope. So there's still work to do in that, but defining exactly what everyone means, even just, and this is an aside, but it is the sort of extent of the frustration, even just being able to identify shared technologies between manufacturers, where the manufacturers have different names for the exact same thing, which have all been probably made by the same subcontractor in the first place. It's the same stuff. Is a job in itself. And this is why I keep going back to this point about time, is that to unpick this is proper work that needs to be done, but will take time to do.
yeah,
Thing I'd like to say as well around those contributory factors is, you've heard lies, damn lies, and statistics, insert contributory factors. We now have road safety factors. And I think when we've got enough evidence from those, that's going to give us a much better idea of what's going on and what the intervention might be that could have prevented that. Might and could, used very deliberately there. Fail to look should be used in almost every single collision, and is quite often the default that police officers use when they just don't have any other evidence. Well, they must have failed to look, otherwise they wouldn't have had a crash. So I would hesitate against analysing that contributory factor in too much detail.
Okay, thank you. And I'm sort of jumping between some of the questions in the Q&A and some of the questions in the chat, but there was one in the chat about if the cost of incidents to the country is 43.5 billion a year, and phone use incidents equate to just 5% of this cost. Shouldn't we look at reducing the connectivity a driver has while driving? Any views on that? Susie, do you want to pick that one up?
And you say, I think we're now at 55 billion value of prevention of all road traffic collisions, so it's even higher. When it comes to mobile phone use, we have this weird situation where we have something that's lawful that is almost as dangerous as the unlawful thing, and I think that probably needs to be addressed at some point. So taking a call hands-free is just about as bad as taking a call holding the actual phone. And the actual physical act of holding a phone isn't the problem, it's the mental engagement with having a conversation with someone who's not present with you, and that's the issue. But distraction, mobile phone use, all of these human factors are so very important. But I would also say, of course, that the system has to be built around the fact that we are going to do silly things from time to time, and that we are going to make mistakes. Even if we aren't holding a phone or having a conversation, we'll still make mistakes. So think about the injury outcome and the causation of the injury, as well as the causation of the collision in the first instance, would probably be my little bit of advice. But yeah, we need system-based interventions that stop people from using mobile phones. So my Apple phone knows that I'm driving, and it goes into don't interrupt me mode. Great. Why don't they all do that? I don't really understand if Apple can do that. The only inconvenience to me is that when I'm on a train, it thinks I'm driving, and I just have to say, no, I'm not driving. It's okay. I can interact. So yeah, we need those system-based interventions, because we are fallible and we will do silly things from time to time, and we just need to recognise that we are as such. And maybe let's make it the law that we can't have any sort of mobile phone use whilst driving a car.
Yeah. No, thank you, Susie. I talked about known knowns and known unknowns, and I think part of the bit about missing data is around stats 19, what can be shared and what can't be shared due to sensitivity. So I was going to explore that as a question. But there is a question specifically on stats 19 in the chat. An example, there's a lot of information gathered on stats 19 that could be better utilized. We see motorcycle KSIs at 21%. How many of these are on illegal devices or unlicensed riders? This has grown massively since COVID, rather than bona fide L riders or full license holders. This data is gathered, although in the GB stats they are lumped together. Changes to training and testing must be driven by bona fide user data, as legal user data needs to be instead drive and enforcement consideration. So anything on that specifically? Ivo, do you want to pick that? Oh, Richard. Ivo first, and then Richard. Sorry, there's a real hand and a virtual hand. Sorry, Ivo.
Yeah.
Slow.
So this is really, I think, a question about the DVLA. So and about the nature of how crash works. So I would say that the SH in crash, which is meant to stand for sharing, is a little bit ironic. But the data to for these sorts of data linkage to work, we have to record stuff excellently, and we have to be willing to share. And I think at the moment, neither of those things are at a level where we're ready for that. The Road Safety Investigation Branch should be able to get this kind of data from DVLA, but the history of getting stuff from DVLA, as Richard said, we're circumventing that by paying, and they're much easier to work with when you just give them money. And we have had situations where the department can't get hold of stuff that is actually simply just purchasable. In terms of vehicle data linkage, the department gets one cut of the vehicle database 4 times a year. The commercial operators, so Halfords, your car insurer, or frankly anyone with the money, gets 12 cuts a year. So they're getting much more up-to-date data than the state ever would. So those kinds of things need to be fixed. I know that we did run 2 years of number plates from Stats 19 through the MOT checker, and 2.5% of them should have had an MOT and didn't, and that's just the ones that had a number plate that looked right. I'm sure the ones that didn't have a number plate looked right definitely didn't have an MOT. So all that kind of stuff is technically very, very straightforward. The actual act of doing that work is really easy. The challenge is in saying, can this lot of people have this from this other lot of people, and coming up with an arrangement whereby you can get that data into the same computer at the same time. The actual doing of that, frankly, is a doddle compared to the rest of it.
Okay, thanks very much, Ivo. I know, Rich, you put your hand up, but I'm conscious we might be close to time on this, so I might need to hand back. There were a couple of questions about that we didn't get through, so apologies to the people that asked those questions, but I would like to thank all the panel members for such thorough and engaged and knowledgeable answers to the questions, and a bit of fly by your seat type session with questions from an engaged audience. So thanks very much for the questions from the audience as well. But I think we're out of time, unless there's time for 1 or 2 more questions. I'm not sure. I'll just pass back. I think we're maybe running to time.
Thank you, Justin. I think it's time to finish, and we had scheduled in a 10-minute break here. So what we will do is start. I'm running a little session. What does the strategy do for you? Which we will start at 5 minutes past 11. And if you want to look at other specifics of what's happening for the rest of the day, I've put that in the Q&A. So we'll pick up again at 5 past 11. Thank you very much, everybody, so far.